This could be the single most effective myopia control method available to us right now. I'm referring to the second generation Hoya Miyosmart IQ eyeglass lenses. As of May 2026, the 12-month results of this lens were presented at the annual meeting of the Association for Research in Vision and Ophthalmology. An online article was also released. The results are groundbreaking to say the least. Here are just a few conclusions drawn from the randomized controlled clinical trial. The study consists of 196 children in Hong Kong aged 4 to 12 with myopia. Conclusion 1. Miyosmart IQ is able to halt clinically relevant myopia progression for 9 out of 10 children over the first year of wear. Conclusion 2. Those who wore Miyosmart IQ spectacle lenses showed no myopia progression on average at 12 months. Conclusion 3. Miyosmart IQ reduced axial length elongation to levels below or comparable to emmetropic, that is, normal or healthy, eye growth. Let's look at the data from which these staggering conclusions were drawn. I've summarized the average results of the study into the following table. We see at 12 months, the average progression in the spherical equivalent refraction, that is, the eyeglass prescription for those wearing traditional single vision lenses, was minus 0.53 diopters. Here is the curious bit. For those wearing the Miyosmart IQ lens, on average, the prescription actually improved by 0.05 diopters. Based on another previous study result, we know this effect is likely due to the phenomenon of choroidal thickening. The choroid is a vascular middle layer of the eye, which is responsible for supplying blood and nutrients to the retina. When myopia-controlled treatments successfully change how light hits the retina, they trigger chemical responses that cause the choroid layer to thicken. It is believed that the choroid also plays a role in regulating the outer wall of the eye, that is, the sclera, from overgrowing. So no, it is not reversing the elongation of the eye, but it is a fascinating result to achieve greater than 100% myopia control in refractive error indeed. Now let's take a look at what the axial length data shows. The axial length for those wearing the traditional single vision lenses was 0.346 millimeters and only 0.075 millimeters for those wearing Miyosmart IQ lenses. That is a roughly 78% reduction in axial length progression. For your reference, normal eye growth of school-aged children is roughly 0.1 to 0.2 millimeters per year. This means for those wearing Miyosmart IQ lenses, their axial length elongation is reduced to below or comparable to normal eye growth. Now, Hoya could have left it at that, but they were thoughtful and honest to point out a trend that they noticed in the study. As it turns out, for children who are younger, ages 4 to 6, the myopia control efficacy of the Miyosmart IQ lens is less than the average results shown in our previous table. However, for children who are older, ages 7 to 12, the myopia control efficacy is even greater than that of the average data we looked at. They didn't mention why there is a discrepancy in the effectiveness of the Miyosmart IQ lens for the different age groups. My humble guess is if a child is myopic at age 6 and under, there's likely a genetic component at play that is beyond what myopia control eyeglasses can completely negate. Does this mean that children ages 4 to 6 shouldn't be wearing Miyosmart IQ? Absolutely not. Those figures only look less impressive next to the other age groups' data. It actually sets a benchmark for myopia control efficacy for such young ages. If you're interested in ordering a pair of Miyosmart IQ lenses for your child, feel free to email us at info@ardentvision.ca to learn how. I hope you're as excited as me to see something as effective as Miyosmart IQ for myopia control in children. This will undoubtedly be part of reshaping the next generation's eye health. I'm Dr. Jennifer Wan, an optometrist passionate in delivering eye care videos so someone's vision out there might benefit. If you found the video insightful, please press like and subscribe. I'll see you in the next one. Bye!